Thank you for having me. I'm a retired obstetrician, and as someone who's Black but appears to be white because of my interracial background, I've seen how racism shows up in healthcare. And so I have a special passion about addressing the injustice that I can now see is perpetrated through obstetric violence. So we're going to talk about birth trauma due to obstetric violence. I'm co-founder of the Black Coalition for Safe Motherhood, which tries to prevent this issue through our ACT curriculum, as you will see later. We're going to talk about what is birth trauma and obstetric violence and explain how it happens, how to prevent it, and what to do if someone has experienced this kind of trauma. Birth trauma is distress experienced by a mother during or after birth. It can be physical due to unavoidable complications of birth, but it is often related to mistreatment and is often emotional or psychological with lasting impact. Obstetric violence is mistreatment by medical personnel during labor or birth. It is a common cause of a traumatic birth experience. In at least one study, 45% of women reported that their birth was traumatic. Obstetric violence ranges from disrespect to physical assault. Obstetric violence may include verbal abuse, such as joking about pain and loss of autonomy during the admission process or while in labor. Paternalism, such as saying, you're not allowed to do this or you're allowed to do that, being treated like a child. Ignoring a birth plan or patient's preferences. Dismissing patient reports of pain, reports of shortness of breath, chest pain, etc. You can see how this can be dangerous. And of course, there's the microaggressions, racial microaggressions and disrespect that are fairly common. Coercion to comply with what the medical staff wants the patient to do is obstetric violence. Sometimes a biased information is given to patients to convince them to do something that they don't want to do. Threats of harming the baby, such as saying, you don't want your baby to be hurt by your saying this or that, that you don't want to do this or that. Or you could be hurt if you don't do this or that. You might get an infection, etc. Sometimes they try to say they're going to call Child Protective Services and your baby will be taken. Fear and shame are regularly used to coerce birthing people. There's also a lack of consent, lack of information given when procedures are done. Someone might just come in and to the labor room and say, oh, we're going to check you now, and pull the lady's legs open and do a vaginal exam. And in the office, sometimes the doctor will say, oh, I'm going to check you. And they'll be stripping the membranes, rubbing the bag of waters without telling the patient. They might break the bag of waters during an exam in the labor room before the birth, trying to speed it up. They could try to speed up the birth by cutting an episiotomy, cutting the vagina to make more room for the baby to come out more quickly. Sometimes physical restraint, holding a mom's legs, etc., and other forced procedures are done. And this is considered to be assault. In the Giving Voice to Mothers study, 2,700 women in the US were surveyed. 1 in 6 US women, including white women, reported mistreatment giving birth. About 27% of women of color with socioeconomic status, lower socioeconomic status, report mistreatment. Black women, Hispanic women, Asian, and Indigenous Native Americans were twice as likely as white women to report that a healthcare provider ignored them, refused their request for help, or failed to respond to requests for help in a reasonable amount of time. You can see how this treating them as if they were not valued can be dangerous and cause life-threatening complications. Disrespect, degradation, assault at birth can cause post-traumatic stress disorder. It can cause postpartum depression or anxiety. Previous trauma increases the risk that someone will be traumatized by their birth. Disagreement with medical personnel may result in more mistreatment. In fact, in the giving birth to mothers study, they showed that there were 80% of those who disagreed experienced mistreatment. Impact of all of this mistreatment of moms can be devastating for infant health and the long-term health of the mom. Why is this happening? Well, we can look at the history of obstetrics to see why. It's the sexism and racism which influenced the mistreatment, the abuse, the torture of enslaved Black women in the 1800s to develop the procedures that were the foundation of obstetrics. The C-sections and the vaginal surgeries that were done at that time were obviously without consent, and these were led to the formation of the obstetrics and gynecological specialties. The hospitals and doctors capitalized on this new specialty by convincing women that birth was dangerous. The pathologizing of birth and convincing women that they should not deliver with midwives and come to the hospital instead was based on a capitalistic motivation to make more money. And so there was a virtual eradication of traditional African-American midwifery by calling midwives dirty, uneducated, etc. In the meantime, there was miseducation of doctors and nurses about birth and about immigrants, Black people, etc. And this goes on today. There's also, in general, a culture of disrespect in medicine. This was written about by Dr. Lucien Leap, the father of patient safety, and his article, The Nature and Causes of Disrespectful Behavior by Physicians. This behavior threatens organizational culture and patient safety in multiple ways. I'll just highlight one of them. Dismissive treatment of patients impairs communication and their engagement as partners in safe care. How can we prevent obstetric violence? Well, we can check out maternity services before going. And we can learn about pregnancy and birth even before childbirth classes. Early on, check out what kind of pregnancy, what kind of birth is what you need, what you prefer, what would you value based on what you've learned, and then make a plan. Choose a Black midwife. Midwives center their clients as opposed to doctors. Doctors are not well-versed in person-centered care, which honors the needs, values, and preferences of the person. But you may find a doctor, especially a Black doctor, with whom you can partner. And also consider community birth at a birthing center or at home versus going to the hospital. But wherever you give birth, know your rights. If you're supporting someone, help them to learn about their rights. There's multiple places where you can find universal rights for birthing persons, or specifically birthing rights for Black birthing people. Bring a copy of it with you to the hospital. When in the hospital, it's important, or in the doctor's office or clinic, bring a doula or a well-informed partner or advocate. In advance, learn about the policies and the names of those in charge. Find out who's in charge when you arrive on labor and delivery. And then when you're in a labor room, get the names and titles of the staff who come in. Post the patient's Bill of Rights of that institution. Bring your birth plan and give out copies to everyone who's taking care of you. Give and expect respect and empathy. If not, ask for another nurse, ask for another doctor. It's within your right to do so. So knowing your rights is very important. This is just a brief summary of some of the most important ones: the right to respectful, safe, quality care, the right to ask questions and get the information that's needed to make informed decisions, and of course, the legal right to be informed before agreeing to any test or procedure. Childbearing does not limit rights to bodily autonomy, dignity, and self-determination. And the pregnant person is the decision maker. The pregnant person is the decision maker for her baby. Informed consent is a process based on the best medical evidence, not on hearsay or what's convenient for the doctor. It's a legal right to be informed about the nature of the treatment or the test or operation that's being recommended. It's your right to be informed about the risks of harm and the potential benefits of the procedure. And it's a key to know the alternatives and the risks of benefits of the alternatives, including doing nothing. This is a conversation. It is not a consent form. Informed consent is not a consent form. A consent form, let me repeat, is not informed consent. That form that you sign is just showing that, yes, the doctor did inform me. Being pregnant does not limit the requirement of a doctor or midwife to honor a pregnant woman's refusal of recommended treatment. And this comes from the American College of Obstetricians and Gynecologists. Their ethics committee created this statement in 2016, and the governing body agreed with it. It's something that you can use if need be. The Act for Safe Motherhood workshops are small groups in which everyone can practice asking questions until you understand the answers, claiming your space, both physical and mental. That's bodily autonomy and mental and self-determination. Trust your body, pay attention if something's not right, and tell the support team, tell your provider if something's not right. And when you disagree with the doctor, this is another example of telling your story, saying, I disagree. I prefer something else. If you're reluctant to speak up, what would you feel comfortable saying or doing? Because your life may depend on it. Here are some options. You can say, I need some more information, or I'd like some time to talk to my partner or support person. I think I'm going to decline, doc. No, thank you. That's just not right for me. Not right for my body. Doc, I want a second opinion. You know, this is a copy of your patient's Bill of Rights. And you might want to see the ethics statement about my right to refuse from your American College of Obstetrics and Gynecology. I've seen some handouts like this from Birth Monopoly. That's a group that's advocating for the rights of mothers. And I like what they say when they say practice, practice, practice. That's what we do in the ACT workshops. We practice how to speak up and some of the things that feel good to say. Some of the things that are powerful that they can't really refuse. And I can send a copy if you let me know you need a copy of this. It's anyone who takes the course can give out copies. You want to set the tone with love and humanity. I love this concept. I certainly remember how more relaxing it was when I went into a room and the couple or the family said, here, have a piece of candy, doc. And that would really set the tone. It would all of a sudden break the ice. And that's helpful when the staff is stressed out. Maybe they've just been recently traumatized by some other situation. It helps to make it clear that you're on the same team. And as I say, you give respect and expect it. This is the second part of that same handout. If the situation is becoming urgent and you're not being heard, here's some more things you can say. And again, we practice these situations in an ACT workshop. What happens if there is a traumatic birth? What can be done? Lawsuits rarely help. It takes years, and it usually requires that a medical, severe surgical or medical complication has occurred. But it's important to get support, to talk about what happened, to go to therapy, get medical treatment if severe depression or anxiety has developed. It's important to let them know what happened. Complaints, write a complaint about the people involved, send it to the CEO of the hospital, send it to the Department of Health, to the Joint Commission on Hospital Accreditation. Speak to the advisory council of that hospital. There's often a patient advisory council. Write reviews, including use the IRTH app, IRTH. That's IRTH for birth without the B in bias. And have a recording if possible. Make a recording about what's happened and put it on social media or bring it to the attention of the news. This is something that could bring pressure to bear on that particular labor and delivery or doctor, and they will have to respond in some way if they want to have a good reputation. So support is healing before and during the pregnancy and after birth. Encourage moms, shield them from disrespect and abuse, comfort them if they've experienced disrespect. Make sure they're getting good nourishment. Support improves outcomes. It's actually healing for the mom, and it can improve outcomes for the baby as well. Gather a team is what we encourage moms to do. Be on a mom's team if you're in their community, their friend, their coworkers. Supporters can help mom get the medical attention that they need to prevent severe complications. If they're not feeling well, supporters can be really helpful because moms will often focus on the baby after giving birth. And about 70% of severe complications and deaths occur the day of and after the birth within the first year. So it's important to support moms after giving birth too. And we're talking about holistic support. So OBGYNs are cautioned to optimize care in a way that affords survivors of previous trauma a sense of safety and control. That's the way that the OBGYNs, the midwives, can prevent re-traumatizing patients during the current labor and birth. Thank you for your attention. I look forward to your questions.